Hello, everybody. This is Dr. Tim Speicher from the Position Release Therapy Institute, also from Elevated Performance and Rehabilitation, the clinic side of PRTI, where we implement what we do in our courses. So one of our recent course instructors, our recent course attendees, asked me a question. What do we do for facial numbness in regards to position release therapy? Well, there's primary three things you need to think about when you're addressing facial numbness with positional release therapy, particularly where is it coming from? And so I'm going to kind of key you in on a couple key essentials, three different areas that I particularly think about and investigate when it comes to facial numbness. One that I just immediately think about offhand is thoracic outlet syndrome. So we have three tunnels, one here is scalene triangle, another here between our clavicle and our first rib, and another here at our pec minor. So we want to screen those individuals for thoracic outlet syndrome. Even though it's here, it can impact the facial nerve and also other associated fascial tissues that actually produce numbness in the face. So that's one. Second is a C1, C2 luxation. And so in our cranial course, we go over this as far as how to find this, but your C1 here, okay, that little spinous process popping out here, okay, we want to make sure those are equal on both sides. And so we go up underneath the ear here, and we'll palpate and see if we can determine which way are we shifted. Now, typically, if there's facial numbness on this side, that C1, C2 will be shifted this way. Primarily, it's mostly C2 that's gone interlateral. It's rotated. And so that can compress the facial nerve structure, as well as the vagus nerve and the glossopharyngeal nerve. So good to look out for that. And then third is actual just fascial binding, and it's just really impacting the facial nerve. And I'll throw up a little sort of slide here that kind of provides a little bit of the anatomy there. And also for that C1, C2, and greater understanding of how those can impact the facial nerve and some of the sort of numbness that it might produce if we have some binding there or in and around this entire area here. And so as far as position release therapy, one, get down to the root of the problem first. And that way you have a sense of where you need to release, where you need to take pressure off certain structures. But in regards to just numbness here, I would start with investigating those three primary conditions. There's others, we know, but those are three to really look at closely. And then second, really just start releasing. Release the masseter, release the paradergoids, both here, underneath here for your medial, as well as here for your lateral. I would really work on the digastric, the posterior belly of the digastric as well. And then I also go into the zygomatic here at the maxillary and start to release through there. I'm really just trying to release as much structure as I can in this area. I'll even go back here to the suboccipitals, as well as the occipitomastoid suture, and really working the neck tissues down through here to relieve that numbness. So those would be my recommendations in regards to when you're kind of faced with some facial numbness. Find out where it's coming from first. Really investigate those three potential areas. Use the skills and techniques you've learned in our courses to resolve those, and start releasing tissues in and around that area. And so keep in mind, once tissues have been bound on it, once you even release them, they may not fully come back right away. It may take time for that neurogenic inflammation to calm down. So give it about 72 hours to see if it'll calm down. Okay. Hey, good luck with those conditions, and we hope to see you in a future course.